I'm Dr. Ankita Sawant. Welcome back to my channel, and today we are going to discuss about ankle joint. So it's a synovial joint of hinge variety. So the medial and lateral articular surface, upper part of the articular surface, we have lower end of the tibia including medial malleolus, lateral malleolus of the fibula, inferior transverse tibiofibular ligament, which creates a deep socket, which is also called as mortise. So in our upper articular surface, what we have? Medial and lateral malleoluses, okay, of tibiofibular ligament and talus. Upper part में we have medial and lateral malleolus and tibiofibular ligament, and lower part में we have talus. Okay, so this is fibula and this is tibia. This over here will be the talus. Here we have the ligament. So fibula, tibia, talus, tibiofibular ligament, and this portion, this is called deep socket, which is also called mortise. Okay, so that is mortise. Moving further to the ligaments. So in ligaments we have fibrous capsule, deltoid, which is also called as the medial ligament, and one is the lateral ligament. So first we'll see the fibrous capsule. Okay, so it surrounds the joint and it attaches all around the articular margins. Okay, so anterior and posterior part of the capsule are loose and thin to allow the hinge movements on each side. However, it is supported by strong collateral ligaments. The synovial membrane lines the capsule. The joint cavity ascends from some distance between the tibia and the fibula. So basically, fibrous capsule surrounds the joint completely. Okay, moving further to the deltoid ligament. In deltoid ligament is also called as medial ligament. So it's a very strong triangular ligament. So this ligament is so strong that this very rarely, this is the strongest ligament of the body. Very rarely it is torn. So at times what will happen is the bone chip might come out, but this ligament won't be torn. Okay, so just imagine how strong this ligament is. So it's a very strong triangular ligament which is present on the medial side of the ankle. So it is divided into two parts, superficial and deep. So in superficial we have tibio navicular. So you have to imagine the parts now. Okay, so you have to sit with the bones. Tibio navicular means from tibia to navicle. Okay, so superficial part mein we have three: tibio navicular part, tibio calcaneal, and posterior tibio talar. Okay, so tibio navicular, tibia से navicle, navicular bone, tibio से calcaneal bone, and posterior tibio talar, tibia से talar. Okay, now we'll move on to deltoids, deep part. So basically deep part is attached to the anterior part of the medial surface of the talus. Okay, we'll also see the diagram which is coming, just stay tuned for that. So blood supply, we have anterior tibial, posterior tibial, and peroneal arteries. So ankle is supplied by tibial, anterior and posterior tibial, and peroneal arteries. Whereas the nerve supply, we have deep peroneal nerve and tibial nerve. Okay. So now we'll see the relationships. So relation of the ligament, relation of the ankle joint, sorry, I beg your pardon, relation of ankle joint. So anteriorly we have 4 and posteriorly we have 5 tendons. So first, this is the anterior surface. Okay, so we have tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. This is the medial malleolus. Then we have tibialis posterior, posterior 5, posterior tibialis posterior, flexor digitorum longus, flexor hallucis longus, peroneus longus, peroneus brevis. Okay, So these are there are also vessels, anterior tibial vessels and all, deep peroneal nerve vessels we have. So this was all about the relationship. So this is the medial malleolus, this is talus, this is lateral malleolus. This is the relationship of the ankle. Okay, so this is the deltoid ligament now, triangular form. Okay, so it has three parts which we had just discussed. The posterior tibio-talar ligament, okay, posterior tibio-talar, from tibia to talar. Then we have tibio-calcaneal ligament, tibia calcaneal. Okay, then we have tibia navicular. This is tibia to navicular. So this is anterior tibio-talar ligament also shown here. This is the medial malleolus. This is talus, calcaneus, spring ligament, and navicular bone. The medial. Okay, so this is the medial side. Lateral ligament we have anteriorly talofibular, from talus to fibula. Then posteriorly we have talofibular. One is anterior talofibular, other is posterior talofibular. And also we have three lateral ligaments. So the third lateral ligament is calcaneofibular ligament, from calcaneum to the fibula. Calcaneofibular ligament. So this was the lateral, medial. We saw in ligaments fibrous capsule we saw, deltoid ligament we saw, and lateral ligament we saw. Moving further to the movements. So in ankle joint, uh, tibiocrural joint, we have dorsiflexion and plantarflexion. So what is dorsiflexion basically? It is the forefoot which is raised, and the angle between the front of the leg and the dorsum of the foot is diminished. It is a close back position with maximum congruence of the joint surfaces. Okay, so dorsiflexion is raising of the forefoot, and dorsiflexion is caused by tibialis anterior. Okay, tibialis anterior is the main principal muscle for the dorsiflexion. We'll also see the accessory muscles. So in accessory muscles we have extensor digitorum longus, extensor hallucis longus, and peroneus. Next movement of the ankle joint is plantar flexion. So what is plantar flexion? So here the forefoot is depressed. In dorsi the forefoot was raised. In plantar forefoot is depressed and the angle between the leg and the foot is increased. High heels cause plantar flexion of ankle joint and its dislocations also. Okay, so high heels, plantar flexion. Just remember that. So principal muscle for that is gastrocnemius and soleus muscle. Accessory muscles are plantaris, tibialis posterior, flexor hallucis longus, and flexor digitorum longus. Alright, now we'll move further towards the applied anatomy. So ankle sprain. So it is basically over stretching of the ligaments. Ideally the twisting turning happens in the ankle, and due to that the ligaments get sprained. Ankle sprain is the most common conditions we see in sports and normal also individuals. Fractures and dislocations are very much common in ankle, especially old ages. And then we have Pott's fracture, which is the malleoli fracture. So these were all the applied anatomy of the ankle joint. I hope you liked the video. So this was all the basic, very basic first year level anatomy which I'm going to cover, which I am covering throughout my videos. Next we are going to see is tibiofibular joint. Then further we'll see joint of the foot, sorry. So stay tuned for the video. I hope you like the video. Stay like, share and subscribe. Share with your friends. Keep learning. Thank you very much.